Hello, welcome to Inside Leisure World. My name is Ethel Lover, and today we're going to be talking about acupuncture and how it can help your health. And my guest is Dr. Clifford Lee. Hi, Dr. Lee.
Hi, how are you?
Fine, thank you for coming.
Thank you for letting me have a chance to speak about what I do in my profession and at the school where I work at, which is the Southern California University of Health Sciences in Whittier, California.
Mm-hmm.
And we have a school university clinic there that works with acupuncture patients, chiropractic, and massage therapy and other complementary health therapies.
Okay. Now, I want to ask you, what is acupuncture?
So acupuncture is a modality, part of traditional East Asian medicine. And with traditional East Asian medicine or Oriental medicine, we look at the body a little differently than biomedical point of view. So from our point of view, we look at the body as a series of pathways throughout the different parts of the body where what we call qi or energy flows throughout. And whenever the energy is flowing smoothly, that's when good health is resulting. But if any blockages occur or any kind of disruptions of the flow, that's when disease or pain or something wrong that we need to treat occurs. So within that medicine, one way to treat that is through acupuncture, where we use very thin solid shaft needles to place them at certain spots of the body to help redirect the flow of energy. From a biomedical point of view, acupuncture, how it works is when it enters the body, it creates a signal that's sent to the brain, where the brain can send out certain hormones or neurotransmitters that will jumpstart a healing process for the body. So that's one explanation of how acupuncture works from a biomedical point of view. But I already explained from our point of view, and it's basically from a qi or energy point of view, where we are trying to make sure that energy flows smoothly throughout your body.
Okay, and then you're going to show us a demonstration of how you do the acupuncture.
Yes,
Okay.
I will show you just a very brief demonstration of what entails with an acupuncture treatment. So I'll briefly show you what acupuncture entails or what you might expect in a treatment with acupuncture. So for example, if I have this model here, well, first, like I mentioned during the interview so far, that we would examine the patient, get the patient's history, and from that make a diagnosis of, and then from there we would make a prescription of what points we would like to use. But I would, for this show, I just want to show you one particular point, and it's located between the first and second metacarpals on the hand, on the dorsum part of the hand, in this part here. And this is one of the more commonly used points in treatment. Oftentimes it can be used to treat the upper part of the head or the arm or anything upper part of the body. It can also help clear the eyes or the throat and help treat common cold as well, to help the body to heal faster the common cold. So I'll show you now the sample insertion of the needle. So here's one acupuncture needle. It's individually wrapped in this case. It's, as you can see, it's very it's a hair thin solid shaft, not like what you get from injections or syringes, which are hollow shaft. This is solid shaft. So with the solid shaft, you will get less trauma, less pain than from a syringe. So I would take the needle out of its wrapping. I can use an alcohol swab to clean the site of insertion. And this point here, I'll just tap it in and push a little bit there, and then that's it. That's the insertion of the acupuncture needle. So I would then go to different parts of the body where I think the patient would need, insert the needles in different points. Oftentimes the patient would on our treatment table, just rest there for like maybe 20 minutes. Sometimes the treatment can last up to 30 or 45 minutes. And then at the end, then we would remove the needle, properly dispose it in a sharps container, and then the patient is finished with the treatment. And then we can talk about what the patient can do at home for lifestyle advice or diet advice, or any, let's say it's pain related, what the patient can do to help the pain at home. And then we talk about the schedule of future treatments.
Okay. Can acupuncture be used together with traditional medicine?
With other types of traditional, yes, it can. Because, like I said, acupuncture is just one modality, one tool as part of the East Asian medicine. We have also herbal medicine, where we can create a formula or put together a formula of herbal ingredients that includes plants, or mostly plants, or leaves, roots, that can act as a medicine for the body too.
So it works really good working with the herbs and
yes.
acupuncture.
Yeah, the combination, because it's part of the same, part of the whole medicine. So, like I said before, acupuncture is not just the whole medicine itself; it's only part of it. It's the most famous part, because that's where a lot of people are looking for that through the media and so forth, and then also it's being funded through some insurances as well.
Yeah. Now, how old is acupuncture?
So acupuncture, as part of that medicine, is at least 3,000, some say up to 5,000 years old. So it's at least several thousand years of history behind this Oriental medicine.
Now, is there any side effects of
in terms of effects that need to be treated, relatively little or none.
Okay.
I mean, you might experience some maybe some soreness, or maybe some brief pricking pain during the treatment, or maybe sometimes some bruising. But in terms of any side effects that need treatment, no.
Say, for instance, if someone has cancer and they're going through a lot of treatment, can this help also?
Yes, acupuncture and Oriental medicine can serve as a complementary therapy to the patient's cancer treatment. So, for example, when the patient is undergoing chemotherapy, a lot of times one of the side effects is nausea, reduced appetite, and so forth. We can help to treat those side effects to help the traditional therapy of the chemotherapy go more smoothly.
Well, what about menopause?
Menopause, we have certain treatment protocols too that can help a patient's experience with menopause. So, for example, we can try to reduce the frequency, or try to reduce the intensity of the hot flashes. We try to regulate the hormone level of the patient, so that that process is going more smoothly.
Okay, now the facial. How does it help your face? I mean, like Botox or something.
Well, in any kind of treatment regarding, like, so you're probably referring to more like cosmetic acupuncture or something. Well, in general, when we look at the face from the Asian medicine point of view, we're saying that anything showing from the outside is a reflection from the inside. So if your inner health is good, your outer health will be reflecting that. So that's why when we treat someone's maybe internal issue or internal problem, a lot of times the patient might even experience more clearer skin or healthier looking skin. So we're not going to do anything drastic like cosmetic surgery where you're going to totally revamp your face. But little by little we can show improvements in the way the skin looks because it's reflecting the inside. Now there are some treatment protocols where we do insert needles directly into parts of the skin to help smooth out the skin and reduce wrinkles. But again, it's not a drastic effect. It's very subtle, little by little effect that can occur.
Well, how does it help weaken organs?
Weakened organs. So a lot of times actually the herbal therapy is more effective in trying to strengthen the organ. With acupuncture, we're trying to make the flow of energy and also blood more smoothly, so that the inner organs can get the proper nutrition and proper supply of nutrients from the rest of the body. But if we want to actually strengthen the organ more directly, the herbal therapy is probably more effective that way. So we can use a combination of herbal therapy and then acupuncture to try to again redirect the flow, make the flow more smooth.
What if someone has a bladder problem? Does it help bladder problems?
In some cases, yeah, we can try to help. For example, we can try treat conditions like urinary tract infection. We can try to treat incontinence, strengthen the bladder, and things like that. So yes, bladder issues, bladder problems can also be treated. So.
What about weight control?
Weight control, yeah. So we can help with, again, and for the weight, something like weight control, it depends also on the patient's own effort. So the treatment from our point of view can help amplify the patient's efforts. And in one way to do that is try to make sure the metabolism is working well, make sure the organs are doing its job, like the digestive system is working well, your bowel movement is good, reducing stress, because a lot of times weight gain is also associated with stress, and also the release of the stress hormone that can lead to the increase of belly fat. So if we can work on all those factors, especially also sleep as well, if you have good sleep, you can it's more easy to lose weight that way. So with all those factors, we can treat those to make sure those factors are going smoothly, so that you have the optimal environment for either maintaining weight or trying to lose weight.
Oh, what's the yang energy? I saw something about a yang.
So,
what does that mean?
So the theory behind Eastern medicine acupuncture is that there are two opposing energies or forces. They call the yin and the yang. So we're trying to balance those two forces. That's another way of working to make things go smoothly. So with the yin, for example, we're talking more about substance and material, like blood, for example. And yang, we're talking more about the energy type more, so, and air, breathing, so forth. So when we combine those two together, we're trying to make a healthier person as a whole.
Okay. Now, what about the eyesight?
Eyesight, yeah. So all these conditions you're mentioning, yes. We can work on either stopping the progression of losing eyesight, or we can try to improve someone's eyesight. And again, we see the eyesight as reflecting something going wrong inside. Like, for example, we want to make sure the blood flow is going well to the eyes, or we want to make sure the internal organs like the liver or kidneys or things like that to working well. So if we can improve those, then something like eyesight will result from that.
That's wonderful. Do you work together with doctors in treating for acupuncture?
Yes, especially through the
medical doctors.
Yes, especially through the insurance system. We have to often be in communication with medical doctors and people's primary care physicians. So a lot of times we'll get referrals from medical doctors for certain conditions that they think acupuncture might be effective in treating them.
Does one have to have a prescription to get the treatment, or can they just call and make an appointment?
Well, depending on the patient's insurance, they might need a official referral or a prescription. But if they're not going through insurance, or if they have something like a, PPO, they can go directly to our clinic and make an appointment.
Oh, okay. So besides insurance,
You can pay through insurance, through cash, and then.
oh,
You can-
that's great. Now, far as say someone's having physical therapy, and they're not feeling better, would it be good to have the acupuncture?
You mean in combination?
Mm-hmm.
Yeah, so sometimes a patient will be undergoing either two or multiple therapies at the same time. So for example, let's say a patient undergoing physical therapy, something like acupuncture might help to complement that therapy so that the patient gets the most out of both of them. Sometimes a patient benefits better from sequential therapies. That means that one therapy at a time. So you might want to try physical therapy first and then acupuncture second, or vice versa. So it depends on the patient what is best for the patient. Either it can be combination therapy or co-management through different therapies like physical therapy or acupuncture or even chiropractic or so forth.
Oh.
Or you can go one by one.
That's wonderful. Now, massages.
Yes.
Does that work together with acupuncture?
Yeah, that can work well too. So sometimes one protocol is that you can undergo massage therapy first, and then and then the muscles are more relaxed, and the insertion needles can be easier for the patient too. So that can be a possibility for a patient as well.
So what it sounds like, anybody can get acupuncture.
And in most cases, yeah, anybody, and depending on their condition, of course, we can always do a first consultation, make sure we get the patient's history. We do a physical exam and different testings of different parts of the body, and then we can talk with the patient about what Eastern medicine, East Asian medicine, or acupuncture can do for them.
I know when you come in, you're looking for certain things. You look in the eyes.
Yes.
What are you looking at when you look at the tongue? What are you looking for?
So there are a couple things or several things that we look at the body, not just from a biomedical point of view where we do muscle testing or we take temperature or blood pressure and so forth. We do all that as well, but we also do other diagnostic testing. For example, we look at the tongue, the color, the coating, the shape that can help us diagnose inside as well. Because we look at, part of our theory is that we view the tongue to give us a reading of what's going on inside as well. And then we also look at the pulse as well. We look at the quality, not just the speed and the depth. And when we read the pulse, we can also get an idea of what's going on inside.
That's amazing. Wow. So if you look at the tongue and somebody has a thick tongue, what does that mean?
So sometimes people with a swollen tongue, sometimes that might mean that some, like the water flow or the water circulation in the body might need treatment or need to be addressed. So when a person's, for example, retaining liquid or so forth, sometimes the water is not flowing well in the body. That is reflected by accumulation of what we call dampness in the tongue area, and that's why the tongue gets swollen. So we can read it that way, and we need to address the person's water circulation.
My goodness.
Fluid metabolism.
Well, this is some of the things the medical doctors don't do, you know.
Yeah, the medical these are some of the tools that we use in diagnosing a person that's not part of the practice of medical doctor. Yes.
My. Well, what if the tongue is white?
The white. So first thing, if you're referring to like a white coating. So depending whether it's thin or thick, like for example, if it's thick, sometimes that's due to a person. Again, we're looking at dampness in the body. We're looking at the fluid metabolism as well. Sometimes that's associated with a person having the common cold, but they're having too much phlegm in the lungs or in the upper respiratory system. So a thick coating with the white, sometimes that's associated with that. Other times it might be associated with stomach issues. So sometimes a stomach problem can result in a thick coating and white coating.
Really? Does it detect diseases like cancer? I mean, when you're looking in their mouth, can you tell if there's some signs?
Well, with something like cancer, we of course we always have to confirm with a biomedical diagnosis. But sometimes we can detect that, or we can get like we suggest maybe you might need to check it out through the pulse. So there are certain pulse readings that can reflect a person's maybe illness from cancer. But again, we always have to confirm through biomedical means.
Oh, I know a lot of people say that they've had acupuncture, but they said it was good, but they never could explain how it helped them. But they said, "Oh, it really helps." And you're going, "How does it help?" You know?
Yeah, that's like I mentioned before. One explanation about how acupuncture works is to kind of jumpstart the body to enact its own healing process, and by that when we insert it in certain spots of the body, it sends a signal to the brain to help jumpstart the healing process. But sometimes the person's inner reserves is not enough, and so that's why we use herbal therapy as well and other therapies to try to supplement the acupuncture treatment.
Oh, that's wonderful. What if someone had a broken arm? Can you get acupuncture for that?
So a broken arm or
broken leg, or a hip replacement?
So we can do two things with that. Like we can treat the patient's pain management so that they're try to make their daily living activities as least disruptive as possible. And then the other part is we're trying to help the body with the healing process of the bone, for example. So we can use acupuncture, but again, herbal therapy is probably more effective that way to enhance the bone healing and or the fracture healing.
So, all right. So, is there anything else you'd like to say?
Just I want to say that the East Asian medicine and acupuncture, it's a whole system of medical thought that's based on several thousand years of tradition. It can be a valuable way of looking at your health and to enact your own body's healing process, and it's also good as a complementary therapy to biomedical or Western ways of treatment.
Okay, Dr. Clifford Lee, thank you for coming.
Thank you.
And we're going to have you back again. And we thank you for watching. Goodbye.